Hello again. Um, so as far as race and class, today in this video I'm going to be talking about the ways in which racial and gender dynamics play in health disparities. Again, this is going to be going based off of how I grew up on the reservation and how it's similar in some ways, especially to the article of the Alpha Hospital and the Omega Hospital, private versus public insurance and stuff like that. So growing up, I didn't necessarily think that I grew up in poverty, but because it was so normalized, or my mom made it that way at least. And living on the reservation, we are sovereign nations, meaning that we have our own laws, we have our own health, and we'll have our own health care. Um, we have our own taxes and stuff like that. So we're kind of like a nation to nation relationship. And that relationship was established between the federal government and tribal nations. So a lot of my tribe receives funding for healthcare. And in terms of health disparities, I was able to see how it is on the reservation, considering I was born and raised there and coming down to the city. Um, there are a lot of things that contribute to health disparities. First and foremost, a lot of tribal communities are very poverty stricken. Um, Not only that, but you have an issue of a lot of people may live in rural areas, so they might not have that luxury of going to the hospital because they necessarily don't have the means of transportation. That is a health disparity within my tribal community within itself. So I kind of think of some tribal nations as a third world country and a first world country because there's a lot of health disparities. For instance, we have a high rate of people being diagnosed with tuberculosis, especially diabetes. Not only does it plague my community, but it plagues a lot of other tribal communities in terms of the rate that people are getting diagnosed with diabetes, primarily because colonization has to do a lot with it. We are eating foods to this day, especially fast foods, that is not necessarily good for anyone's health, at least. I know that from what I've learned that the Navajo people and other tribal nations, when they first came in contact with Europeans, our native people were seen as very healthy, young looking people because they lived off the land, they lived off animals. They didn't have things such as sugar, and even if it did, it was more so naturally through fruits or the foods that they grew. In terms of salt or flour, salt, sugar, flour, and lard were four foods that were introduced to not only my culture but other indigenous cultures as well, which is, salt and sugar have a very strong relationship in terms of diabetes. So not a lot of people understand that a lot of what they eat and the exercise is very important and that they should be regulated. But unfortunately, there's also factors or social factors that influence that as well. In my reservation, there's only one grocery store. And on my own town, there's only one grocery store, and that's Bash's. Considering that a lot of people live below the poverty line in my own community, healthy foods can be a little bit expensive. Not only that, but parents don't know nutrition when it comes to feeding their children. It's kind of something that they and not necessarily inherent, but learn from how they were eating. So more than likely, um, if your parents fed you unhealthy foods, you're more than likely to continue that cycle as well. Um, there's a lot of fast food places in my town, which I really don't like. Like the only place that we have in our town that is considered healthy is probably Subway. Um, Not only that, but we have a 24-hour two-way drive-through at McDonald's. And you know that McDonald's, cheaper or the most unhealthy foods are probably the most cheapest and you can buy at large quantities. So, um, parents who don't have the time because they're always working, grab a quick bite to eat is always convenient. Not only that, but many children are not can take into consideration that our bodies change and the social practices change within that based on time and place. So, children, in terms of time today, I have seen a heavily, not heavily, but a lot more younger students being too connected with technology or social media. Kids who don't have, go out and have exercise and would rather stay inside and be on the computer, play games. When you're doing that, you're not exercising anything. Kind of makes us, I would argue personally, that makes us lazy people. In terms of health disparities, since healthcare on the reservation, like I said, has to do with a lot of sovereignty. They are ironically funded by the federal government. So we get funds, or every tribal nations get their, unless and tribal nation is able to sustain itself in terms of providing its tribal members for healthcare. My tribe, it gets funding from the federal government, which comes from taxpayers' money. So when we are only allocated certain amount of funds, and with those certain amount of funds, we have programs, prevention programs, drug abuse, all that stuff, medicine, employees, how are new buildings, new technology to implement in these hospitals. But since that we're already underfunded, understaffed, in terms of money, we struggle with retaining our doctors or our nurses because there is not infrastructure for where these people to live. And not only that, but when doctors come to the reservation, they are accepting the fact that they're going to take a pay cut, meaning that they could be paid more in the city in terms like in Phoenix or another metropolitan area at a hospital that has private insured people. But when you are a doctor on the reservation, there's not necessarily a lot of opportunity, or in general, what keeps a lot of the native youth away from these tribal communities is that there's nowhere to live. There's no jobs. And just like in the article of when the author goes into a public healthcare institution, which is the Alpha Hospital, and how she explains the health disparities there, I saw a lot of how one's social location, meaning that their gender, their sex, their sexuality, their race, where they come from, kind of like their own personal history. And with me and my culture, our history with colonization, losing a lot of our culture has devastated many communities. For instance, we have the highest rate. 1 in 3 women will be raped in their life. Indigenous women will be raped in their lifetime. Domestic violence, alcohol, drug use, stealing, any social ills that plagues any poverty-stricken community, which makes me very passionate about what I want to go into in terms of becoming a lawyer and becoming a leader. And also, I have found a very particular interest in environmental racism and occupational health, and also how policies affect the most marginalized people. I learned a lot from this particular section, and thank you for this video, and I hope you all like it.